Hello, we're so glad that you're joining us for this on-demand webinar titled The New Normal Playbook. NHA certificates will be able to use this content for continuing education. Now, in order to receive continuing education credit, you're going to need to take the related quiz in your NHA CE portal. Now, let's get started. Today, we have representatives from two major healthcare systems discussing interim and long-range changes that are occurring across their healthcare systems as a result of COVID-19. Although each healthcare system is unique, there will be similarities between many healthcare systems. After completing this webinar, you should be able to describe how workflows change as a result of COVID-19, discuss staffing changes that were put into place as a result of the coronavirus and what new staffing models may look like in the future, discuss the role of telehealth and virtual visits, both pre and post-COVID, list techniques that are being incorporated to reduce staff stress and to build morale, describe what workflows may look like in post-COVID-19, list essential skills that are especially important in a post-COVID environment, and finally, discuss lessons learned.
So thank you, Michelle, and I'd like to introduce our panelists today. So please join us in welcoming Samantha Arenas and Davene Yankel to our webinar today. Samantha is currently serving as the Patient Experience Officer for Mount Carmel Medical Group. She's accountable for the oversight and improvement of patient experience across all of Mount Carmel Medical Group care sites. She is also involved in the development and improvement of colleague engagement. She coaches and collaborates with leaders to maintain an unrelenting focus on patient experience, accountability to metrics, and synergies between patient, colleague, and provider engagement. Davene has clinical experience in the MICU and SICU, trauma-intensive care, and open heart recovery, and as a critical care staff development educator and system-wide education specialist for over 39 years. Her past 9 years have been in ambulatory care as manager of clinical services for Ohio Health Physician Group. So welcome, Samantha and Davene.
Thank you.
Virginia Ferrari and I will be the host for this webinar. We both work in product development as content strategists for NHA and have extensive backgrounds in healthcare and in healthcare education.
Thank you, Michelle. And we're going to start off on our first topic today of new workflows. And these new workflows I want to discuss have been during the COVID pandemic. So Davene, let's start with you. What are the biggest challenges that you have experienced in the last 60 days?
Well, I think our biggest challenge, we've had many, is that, this is a precedent. This never happened to us before. So our biggest challenge was really deployment of our staff. We had to come out of our comfort zones, and we had to retrain lots of clinical folks to do jobs that they just they had never done before. For an example, we took cardiac rehab nurses and trained them to do swabbing in our tents. So that was, and the tents, how about that? That's a new workflow. Who would have thought we could work out of tents? But a great idea, So that was really a challenge to just get those set up and get them started. It was in the winter time. So I think that was, and teaching folks in the ambulatory area about PPE and contact strict isolation, they didn't do that in the ambulatory area. So that created a little bit of a challenge as well.
Great. And so in that same line, can you say what worked well and what didn't work well?
Well, we scrambled a little bit in the beginning because I think it was an all hands on deck, and everybody was there like, hey, how can we help? And we want you to do this. And it's like, well, I don't do that. It's like, well, so the training, I think, gearing up everybody and getting everybody trained. I'm in education, so we were like, okay, let's get these folks trained. Let's get scripting put together and let's get this started. So I think that that was maybe something we kind of stumbled on in the beginning, but we got up to speed very quickly. I will tell you one of the best practice workflows that we developed was setting up a mechanism in our physician-patient portal so that they could notify the emergency room. Either the physician or the patient could notify the physician or the emergency room that they were coming, and have a nurse actually waiting for them. If they were COVID positive, had a nurse waiting for them in the ED. And I think that was probably one of our biggest wins, because, patients were sick, they were scared, they were getting sicker, had to come in, and we had a nurse waiting for them. And I hope that practice workflow never goes away, because that was very well received.
Well, that sounds great. Samantha, can you also tell us about your experiences on some of the new workflows as well?
Yeah, I think that, this rate of change that we've seen is unlike anything we've ever seen before. And it's been really interesting that, we've had to make changes that in some ways would take months under normal circumstances. So some of the major areas I've seen change for our organization is in telehealth. It wasn't very widely used before this, and it's just really, we've had to hit the ground running, whether we were ready to or not. So lots of changes there, and everyone's learning that at once. The providers are learning it, the patients are learning it. So definitely a new experience for everyone. And then for those practices that, are still seeing patients in the offices, identifying new workflows, like how can we reduce the contact that our patients are having between the time that they arrive for their visit to get back to see the provider. So developing new workflows on reducing contact, physical contact with people from the front desk, or, just unnecessary contact with others in the office.
Well, that's great. And I'm also going to talk about telehealth in a little bit, but thank you so much for that.
Okay, so we know that staffing was a big issue during COVID. Many hospitals had to make quick adjustments in order to accommodate the anticipated increase in patient volume. Samantha, how did staffing assignments change when COVID hit in your healthcare system?
So I think we're very fortunate. I think people in healthcare generally are very resilient people. They have a natural desire to want to help people and do well for people. So we're very fortunate that people just really were open to change. We had a lot of redeployment of colleagues going to different areas, training and things that they had never done before. And just very impressed by the number of colleagues that were open to learning something new, and really willing to help out wherever they could.
That's great. Davene, how about you guys? Did you have a lot of staffing assignment changes as a result of COVID as well?
Yes, especially in the ambulatory area, because many of those practices were deemed immediately non-essential. So most of our clinical staff were redeployed. Didn't have to furlough any of our folks. We were very lucky.
That's great.
Yeah, Ohio Health was really good about that. They had the option not to be redeployed if they did not want to be, but most of our people were all hands on deck. They were jumping in wherever they could, and most of them were redeployed either to the screening facility. We have we became a centralized screening, so it all came into one area, and where we had nurses talking with patients and giving them information and helping them figure out, do I qualify to be tested? And then we had all of our testing sites, and a lot of those people were redeployed into the testing tents. And then we had other people that were put on task forces to figure out, we had shortages and to get innovative solutions to things that we ran out of. And I know we'll probably talk about that later, but we did pretty good.
What advice do you have for employees that have been affected by any staffing changes, either during or post-COVID-19, knowing that there may be just a little bit of resentment about possibly being furloughed or reassigned?
Absolutely. So I think one of the most important things is self-care. We really promote self-care at Mount Carmel. You can't pour from an empty cup. That's an old saying, and is absolutely true. And when you're in healthcare, you have to be able to pour into other people's cups because that's what you do. You help people. So, really good self-care, and that can look different for different people, but identifying what is good for your self-care and working on that is really important. I also think it's really important to educate yourself. There's been a lot of opportunities I've seen from different organizations for free webinars, free education, anywhere from IHA to Harvard, the Schwartz Group, all of these different organizations are providing webinars for free to people. So, educating yourself is really important to have a better understanding and awareness, I think.
Great. Davene, I know a lot of your employees, or you didn't have anybody furloughed, but as we return to normal, what we think will be the new normal, I should say, what types of things will employers be looking for in staff members as we know that things aren't going to go back to normal? What are you going to be looking for in your staff members as they return to what the new normal will be?
Well, I think we're looking for flexible staff, people that are going to be willing to learn new roles, new ways of doing things. We're looking for those. Well, we found out that those out-of-the-box thinkers, those innovative thinkers, were really imperative to have during this time, because there was a lot of things that we had to go, whoop, that's not going to work. So how do we figure this out? So we're looking for people who are positive, willing to take on new roles, willing to do things differently. If we have somebody that said, you know what, if they think they're going to go back to doing it the same old way, I think they're going to be surprised. I don't think that's going to happen, nor do we want it to happen, because we need to be better prepared, because this might happen again. So
absolutely. Well, thank you both. Those were great answers.
Well, that lets me shift into that virtual visits and telehealth that I was mentioning earlier. So in a recent article titled How the COVID-19 Pandemic is Reshaping Healthcare with Technology, John Kravitz, who's the CIO of Geisinger Health, speaks about how the organization's leaders have been blown away by how technology has stepped up to help address the COVID-19 crisis. So Geisinger is a leading health system with 11 campuses and 13 hospitals in Pennsylvania. Their organization has kept up with a 500% increase in telehealth visits and a doubling of remote workers to 13,000 employees. This seems to be a growing trend, and I would like both of you to weigh in on these questions. So Samantha, can you tell us approximately what percentage of typical outpatient visits are currently being conducted via telehealth?
Sure. So we're looking at approximately around 45% of our visits being telehealth right now, which has been a huge change for us. Of course, that 45% has fluctuated depending on, what outreach measures we're taking as an organization, what news people are getting from, different political leaders and their comfort and personal feelings. But we definitely have seen a huge increase in telehealth in our organization.
Okay. And Davene, what kind of percentage do you think is currently in your outpatient visits being conducted by telehealth?
I'm sorry, I don't have those exact numbers. I tried to get them, but they're so fluctuating. We're probably in that 50% range. A lot of our PCPs and specialties already were set up for e-visits and telephone calls, but the teleconferencing, we have more than 1,000 of our physicians in nearly every medical specialty caring for patients virtually now. So we're pretty ramped up. So I'd say maybe even a little higher than 50%. I'm not sure exactly, but I know we're going to continue to make that an option, because if they don't need to be treated in person, because it's been very well received.
Well, that's great. Could you also tell us maybe what extent telehealth was used prior to COVID then? If you're maybe 50% or more now, what kind of percentage would you just roughly assign prior to COVID-19?
Yeah, in our primary care practice, every physician had access, if you were on the patient portal, to e-visits. And so I don't know the percentage of our primary care practices to our specialty practices, but now specialty practices are actually in that as well. That's the best I could probably tell you on that. I don't have those numbers. I'm sorry. I know that we are ramped up though, and our IT folks have basically put everybody online, and so they're able to do that now.
Well, that's fantastic. And I wasn't looking for exact percentages, so just to see, we've had a big shift, so that's great. Yeah, Samantha, how about your organization?
So I would say that prior to all of this, we unfortunately didn't have access to a lot of virtual or telehealth options. We did asynchronous visits before this, which were a very, very small percentage of our overall visits. I don't even know that they were probably 1%. So I think that, this telehealth journey that we've been on has been really, really different for our colleagues and our providers.
Right, I can imagine. So do you have any additional thoughts on limitations or other emerging technologies that you might end up using going forward?
I definitely see, like Davene said, I see telehealth, continuing to stick around. I think that people, healthcare is a consumerism. We're driven. We're needing to meet the needs of people at the time that they want their needs met. And if that means that we continue to do telehealth, that's what that means. I think that it'll probably dwindle down a little bit after things with COVID settle down, but I do definitely see it here to stay. And I do see more technology maybe happening within the healthcare system that, oftentimes we see these opportunities with other industries, like even restaurant industries, that I feel like sometimes are ahead of us in the technology world, which I just see us using more technology that maybe is outside of the box, that wasn't historically used in healthcare. So lots of opportunity there, I think.
Great. Another question on that line, what can you share about the types of responsibilities that ancillary staff members have had in virtual visits?
So I think that has really varied. We've always had high expectations of our ancillary staff for accuracy and involvement with the patient. But I think that that's even more important now, that we are not seeing patients face to face. There's more room maybe for misunderstanding and mistakes to be made. And so that accuracy is incredibly important right now. And those relationships that those people have with our patients, to further build on that, these difficult times for everyone, I think that continued relationship building with the ancillary staff is really important.
Thank you. And Davene, I recall that you mentioned that you basically, redeployed people. So is there anything you want to add to that as far as ancillary staff in similar or different roles going forward?
Well, we've trained, we've had a lot of training. We actually put a new app onto our electronic medical record in Epic. We put the telemedicine app on there, and so we trained our nurses in that. But our ancillary staff, they are very, with the teleconferencing, they actually call our patients the day before, explain to the patient what they're going to be seeing, tee up that. They do a virtual, I guess it's virtual rooming, if you want to call it. They get them all pre-registered the day before. Then they'll go ahead and get them set up the day of. They have an appointment just like regular. They'll get the physicians, they'll tee it up. Physicians will come in, have that virtual visit, and then the ancillary staff, usually the medical assistant, will come back in and finish up that visit. They'll get their, new med or a script or a test or whatever, finish up with the patient if there's any questions. So different way of doing it. It's virtual, but they're still doing the same job and giving the patient the same care.
That's great information. So I just want to shift a little bit more conversation here on telehealth to the revenue cycle. So reimbursement for telehealth and virtual check-in services have typically paid a low reimbursement in the past. Can you share if there's been an increase or how the revenue cycle has been affected by the use of telehealth services, even though I know there's been some emergency orders in regards to billing, but if you have any information, that would be great. So Samantha, do you have anything to share on that?
So yeah, I think that there's definitely been some shifts in what is being approved as far as payment goes, because historically, telehealth being used as a majority of visit types is not sustainable at the reimbursement rate that it was at. So I hope to see that the reimbursement changes and things that CMS comes out with will stick long term. But it's definitely something that luckily they made changes during this, crisis to meet the needs of the programs and organizations. So.
Yes, I completely agree. And Davene, do you have any experience or comments on the revenue cycle effect?
Yeah, same thing for us. Same as what Samantha said. Up front, patients that had their appointments canceled, physicians went in, there was no reimbursement at that time. Now there is a percentage of the reimbursement. I don't know exactly what that rate percentage is. I'm thinking that that will get probably ironed out as we go forward, because we're never going to get away from those virtual visits. We're always going to be prepared for that, because who knows, this might come around again.
Of course. So both of you, that's great information on this topic. Thank you very much.
Okay, so now we're going to shift a little bit. We're going to talk about staff morale during this time. Samantha, we know that healthcare professionals have been under tremendous stress. Can you share what you've experienced inside your organization as far as staff morale?
Yeah, I think that, there's a wide range of feelings right now across all of our staff members, from people being angry or sad or scared, or, even some people enjoying a little bit extra time at home. There's lots of different emotions. And I think that recognizing that with our colleagues, that wherever you are, whatever your feelings, the feelings are that you're having, those are valid and that's okay. So it's been such a wide range of different emotions and reactions from colleagues in different roles. So just being prepared to, talk to colleagues and let them know that wherever they are on that spectrum, that's okay.
That's great. How about you, Davene? What have you seen in your facility?
Yeah, it's same. COVID has created a lot of isolation and depression, a lot of scared people, not sure afraid to go back into the hospital setting, afraid to go back to their practices. But on the other hand, Ohio Health has always really taken care of their associates. And we've been lucky. We haven't had like our folks in the swabbing tents. We've had no exposures. And so I think the more that goes through, the better they feel about it. They know we have enough protective device. We have enough PPE. We have enough masks. And we have a lot of programs. Ohio Health really does a lot even before this COVID. So they've just ramped up a lot of the services, ramped up our behavioral health, employee assistance programs, funding programs for folks that maybe need some help. We have a concierge service and they ramped that up. Got a lot of free apps from our wellness. Our fitness centers gave us free apps if we wanted to exercise at home. Not that anybody wanted to. Created some childcare for folks, because all the daycare systems were closed. So they created that. Set up special curbside services with a grocery chain here in Columbus, Ohio, so that they could get curbside service. So we even got, I think, a athletic shoe store gave us 50% off on athletic shoes. I think they thought we were all going to go out running. So yeah, so it's been, a lot of fun stuff. You know, they do it a lot. Ohio Health's pretty known for that, but this was, you know, they actually did more, which was kind of great.
That's great. Well, thanks for sharing that. Sam, how about what are some of the things that Mount Carmel is doing for their staff?
Yeah, so we are a faith-based organization. So there's a lot of, prayer that's shared, some positive affirmations. We also encourage EAP use when needed and have provided, different discounts and things through our perk spot. With medical groups specifically, we have worked really hard on developing a daily self-care communication. And that varies from poems or quotes to recipes, educational opportunities, just a wide range of different things that our colleagues can do to further care for themselves.
Okay, great. Well, we know that the organizations, the healthcare organizations, have been doing a great job taking care of their staff. What can employees do to build up each other? Davene, let's start with you.
Well, we have every day for our folks that are out there in the they're out there in the screening centers. We call it the CCT screening centers. They start their morning huddles with inspirational quote. Just something to get them ready for the day, because they're going to talk to a lot of patients that are afraid, have questions. They do the same thing in our swabbing tents. They start with that same thing. So I think, in our WebExes, we tried, because everybody's at home doing these WebExes. We showed, one Friday they showed pictures of they held up their dogs and their cats and stuff, pictures of their kids, or, just trying to bring some, we're in a crisis, but we're still human and we're still peers and we're still working together. And we've done a lot of that in our WebExes, which has been kind of nice because it doesn't make you feel so isolated sitting in your house by yourself. So we've done some fun stuff. We've had some great laughs amongst all the seriousness. So
great. Well, that's wonderful. Sam, how about you? Do you have any suggestions of how employees can help to build up each other?
I think, being supportive and just really being a sounding board for people is really important. Not just patients, but our colleagues, our peers, that's really important as well. And sometimes I think we forget that people just want to be heard. They don't always want a solution or a suggestion. They just want to be heard. And I think that is really valuable right now to provide good listening skills to your peers.
Very good. Now, we have heard all kinds of great stories about how the community has come around all the healthcare groups. Can you tell us what the community has done to support your healthcare workers?
Yeah, we have seen an overwhelming amount of support from our communities. We've had some food vendors deliver food to our frontline workers at no cost, which has been, very kind. We've had floral deliveries to frontline workers from florists around the city. We've had multiple parades, I guess I'll call them, of patients and community members holding up signs and thanking our frontline workers as they're leaving or coming in for their shift. Different drawings in our parking lots with notes of encouragement. We've been very fortunate that our community has supported us pretty incredibly.
That is great. Well, Davene, do you have anything to add? Maybe that sparked a thought, or
we've had, we've had the same. We've had people bring in We've had people bring in food. We've had sidewalk chalk art sent around. Everybody's making signs and holding them up. We've had a lot of things. Like I said, a major grocery chain said, hey, if you're from Ohio Health, we're going to put you at the front of the line for your people. Come in and grab them food. And we know they're tired. We'll have it ready for them. So we've had a lot of people doing that as well.
That is tremendous. That has to make them feel good. There a lot of these folks, especially that are on the front lines with COVID patients, are taking on so much, and to have that appreciation must really help to elevate their spirits during this sad time. So thanks for sharing. That was great.
And next, I want to talk and ask both of you a couple questions about new workflows post-COVID. So Samantha, I'll start with you. Will you share with us some of your plans moving forward, and especially what essential skills are most important in this post-COVID environment that we're going to see?
Yeah, I think that, the workflows were, like I kind of mentioned earlier, looking at fewer contact points with patients. How can we eliminate unnecessary contact? And so I think that will continue to grow and change, as well as many other aspects of patient care, as new treatments are found, new things come out, that's going to change. So with that, I think that, the important thing for colleagues to remember post-COVID is that you really have to be resilient, and you have to be prepared to change. Things are not going to go back to the way they used to be, and they likely will change from this week to next. And just be prepared to kind of roll with the punches and be open and positive about that, and be willing to learn new things. So I think that's probably the most important lesson I feel like I've learned personally, but also that I've shared with our colleagues, that you need to be resilient and positive and calm.
That's great information. So Davene, do you see the workflows going forward, that there's some essential skills that will be considered most important?
Our new workflows are going to totally evolve. I mean, when we start getting back to work, we're never going to go back, probably the status quo. This has changed us probably forever. And I think we're going to look at staffing ratios. We're going to look at testing. We're going to be testing our employees when they come in. They're going to get their temps taken. They're going to have to wear masks. They're going to have to do things a lot differently. So you're right. They're going to have to be resilient, but they know we want to keep them safe. And I think that's the number one rule right there. Everybody's going to stay safe, and we're going to do what we need to do to be safe. We're going to change. Who knows? We might have COVID dedicated units at some point. I know one thing, though, when we start looking at equipment, I think this was a big eye opener. We're going to be better stocked up. We're going to be looking at not being so dependent on things that we can run out of, and maybe come up with more reusable solutions. PPEs and masks, we've gone to a disposable world, and I think that caught us off balance a little bit, because if it's disposable, you have to replace it, and if you don't have it to get replaced, then then you run into trouble. And so little things like temperature probes, we saw, oh my gosh, our levels are going down. So I think we're gonna do things a whole lot differently. And every policy and everything we do, I'm hoping that we look at it and we address, what if there's a pandemic? How does this policy and procedure hold up? Because I think that's going to be in every new workflow going forward.
Yes, absolutely. So thank you so much for that, both of you.
Yeah, and Sam, we're going to kind of go along the same lines that Davene just talked about. We know that many healthcare systems were caught off guard by this pandemic. What are some lessons learned as a result of this virus and pandemic? Where do we go from here?
Yeah, I want to echo what Davene said about supplies. I think that was a huge eye-opener across the board for the healthcare system. I think that, communication and changes. We've developed new ways of communicating that I think will stick around, and understanding that, of course, patient safety and quality has always been number one priority. But in times like this, when you have to make changes so quickly, understanding that, that is still your focus, but perfection can come later. You want to provide safe, high quality care and provide good experiences for people, but, it's not always going to look perfect right away, and that's okay. I think that's been a huge lesson for those of us that are a little bit of perfectionists. So that's been a great lesson learned.
That's great. And along the same lines, we're talking about what we learned. So what do you think hospitals need to do, and workers, as a result of all we've learned? How do we prepare for that second wave of COVID that may be coming our way, or any future pandemics? Davene?
I'm sorry.
No, that's okay. Just be prepared to check your egos at the door and your titles, and all lean into the work. And I think we've learned a lot. We've had a lot of lessons learned, because this was, I wouldn't say this was our first experience with something, because we've gone through the H1N1 and we went through the Ebola, but when it was over, we put it away. It really didn't affect too many of us. This affected everyone. And so I think the lesson learned here is that we're never going to be pandemic proof, but we need to throw out that attitude like, I don't know. I think that the out of the box thinkers were the real champions in this crisis. I mean, we learned a lot by just being innovative, and nobody was ever like, that's not going to work. We're like, okay, let's think about this. And usually one crazy idea evolved into something that really did work. And I can tell you that I think that our policies and procedures are always going to have that. And how does this hold up in a pandemic? I think they're going to keep looking at that. And I think that they're going to look at who the real valuable players are. We have to have a lot of clinical people in place and ready to do the work. So,
that's great. So those innovative thinkers are really important during this crisis.
They really were. Those people that we actually ended up forming a task force, an innovation task force. We pulled into it all these people that, like, in different task force that had like wild ideas that we ended up taking and using. And we said, oh my God, let's get all these people in one task force. And when we have a problem, we'll say, hey, what do you guys think about that? Because these were a bunch of out of box thinkers all together. And so everybody was like, yeah, we'll do it this way, this way, this way. And it was an awesome task force. And if you got asked to be on that task force, they either thought, like they have bizarre ideas that we might be able to use, or whatever. So it was a great way of seeing how we utilize those people. And I don't think that's gonna go away. Sometimes you like to say, oh, status quo. I don't think we're ever gonna get caught like that again. If we do, shame on us, because we better not.
That's great. Sam, did you have anything else you wanted to add?
Not really. I think that, we also have learned that we can do anything. No is not a response. It's let's figure out how. So I think that's been really valuable.
That's great. Well, thank you both. These have been great responses.
Yes, and Samantha, Davene, from all of us at NHA, we'd like to thank you so much for joining us today. This session has been so informative, and we appreciate your time today and your service as healthcare workers. For those of you using this webinar for continuing education credits, don't forget to take the quiz in your CE portal.